Praise his name. Last time we were speaking, one of the things that we said is that we need to monitor, right? We have to um, monitor our blood sugar levels, and there's an easy way or a simple way that we ourselves can do it. You know, we can check on it and we can look at it for ourselves and decide, what how do we put it? This is happening to me, so I need to pay attention because sometimes things happen to us and we don't pay attention. And that's where the problem comes in. And this is what we need to as saints of God, even as people, once we can recognize what is going on in our body, we can take the initial step and have the control to 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 say, well, okay, something is going on here. It doesn't feel normal. It's not normal. And because we don't pay attention to what is going on in our body, by the time something happens, oh, we are in a really difficult place and we have to work harder to bring ourselves back to the place that we want our body to be. And we don't have to wait for that to happen, saints of God. We just need to pay attention to ourselves. We need to pay attention to ourselves. We need to pay attention to what our body is saying. And so there are certain things that we should be looking at if we want to monitor whether our blood sugar levels are high, and you want to find out if your pancreas is working overtime to increase more insulin to deal with your high sugar levels in your blood. If you can start now by looking at that, you can avoid having to go to the doctor. You could, and I'm sure some of you, even in what we're talking about, some of you may be saying, I wish I knew this before. And so this is what we are here to do, to tell you, listen, you don't want your blood sugar levels to go up. When you become diabetic, everything sort of like works over time. And diabetes can cause so much problems in your physical body, you would be surprised. Because high diabetes cause failure. Your kidney can go bad if your sugar is high. Listen, this is not something we take for granted. Your blood pressure can go up. Everything starts to behave in a different way. You lose things when your blood sugar level is too high, which means when you have too much sugar in your blood. And this is something that you have the power from here on to deal with it. You can take control of your body going forward and help this little stomach that is small as the size of your fist to 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 help you to heal well. Help this stomach of yours so that you can stay healthy. Amen. And even though I'm going to give you some examples, right, of some key things that you can look at. But as much as I'm giving you the example, I want you to understand that it may not necessarily be that your pancreas is working overtime. It may not necessarily mean that you have diabetes. No. But what you do is you pay attention and based on what you're getting and ask yourself, okay, do I need to go and check this out? Because you can have these symptoms for something else, but it will not hurt to have it checked out. Amen. It wouldn't hurt you. And don't be scared. One of the things that is associated, and I've known people like that, their eyes start getting blurred, they're not seeing properly, and they just say to themselves, I'm tired. They just uh, choose out, put on a shades, to block it, to block the glare. They rub their eyes, they go and self-diagnose themselves and go to the pharmaceutical places and then you get eye drops and all these things. And blurred vision is one of the symptoms of pre-diabetic signs or becoming someone who has diabetes. So what you do, if you find that you have blurred vision, which indicates something's going on with your eyes, you can go and have your eyes tested. Don't tell yourself, oh, I'm diabetic. No, that's not what I'm saying. You go and get your eyes tested. Go, you can go to the health center if you don't have money to do it privately. And I think now a lot of these eye places where you test your eyes, the competition is a big one, so you can get it at a reasonable price. Some people say they test your eyes for free. Go and get your eyes tested. Too many people have had blurred vision and never went to check it out. And by the time things happen, they get a cut, the cut is not healing, they find out that they're diabetic. And it's like, how I get diabetic? How did this happen? But your body was already giving you the signs. So if you find you're having problems to see, what you do is go and get your eyes tested. Most times, and some of you know that, most times when you go to have your eyes tested, they can tell you that you're diabetic. They test you and they ask you, are you diabetic? And if you say you're not, they say, well, I think you need to visit your doctor because of what they're seeing, and you all would know, some of you would know that. You go get your eyes tested. If after you get your eyes tested, if the doctor doesn't say, okay, well, you're fine to go, you just have short or long or astigmatism like myself, and they give you glasses, right? If you find even with the glasses, you start back feeling your eyes is getting blurry, it's not focusing well, don't just leave it like that. What you do is you make an appointment now to see an eye doctor. Are you all following me? And they would be able to say to you, same thing, if you don't have the money to go in a private institution, go to a clinic and say to them, I want, my eyes are giving me problems, and they'll be able to tell you. And if you've done everything that you need to do and this is happening to you, then it is a possibility that you may be pre-diabetic and you don't want to lose your eyes. You don't want to lose your eyesight, I should say. And that is just one of the reasons. Sometimes people can generally have eye diseases and it has nothing to do with diabetes. All right. Don't think that I'm narrowing it down. I'm just asking you to start identifying and paying attention to your body. Do you all understand tonight? Hope you're following me. Another way that doctors can tell if you are pre-diabetic or they look for in type 1, type 2 diabetes is frequent urination. And let me put it a different way. When you're peeing too much, that's another sign. Again, don't start worrying and going to the extreme because you can be urinating often. And when I say urinating, I mean, peeing. And actually, peeing is a word. I didn't even know it's a real word. I just thought was like something on the side, Dr. Richards, but it is. If you find that you are urinating plenty and you're peeing often, you'll tend to find the first thing that the doctors will do is to check your blood sugar level. That's what Nurse Pario, that's what they're going to do. So, but don't worry about, I'm doing that right now, I'm probably diabetic. Pre that. No. If you are, and I want you to understand something. If you are drinking, consuming a lot of water, like you want to drink water and you're drinking it fast. You're just gulping down. What is going to happen? You're going to urinate quickly and plenty. Because what happens is that when you drink a lot of water, and some of you can identify with that, what's going to happen is that your body is going to dispel the extra water. You don't need all that water one time, just in case if you don't know. And I'm going to teach you something here that we really, we say we're thirsty and we gulp down water, but can I tell you, when you gulp water down, even a glass of water or a bottle of water, you're going to run to the washroom quickly. because you drink too much water too quickly. And so your body realizes, oh, what's all this water about? And then it just quickly lets that water dispel from your body through what you call urine. And I want you to start to pay attention to this. This is important. Start looking at that. And I want you all to, if you never did it before, do it now. Drink a full glass of water. When I say now, like tomorrow, drink a full glass of water and look and see how quickly you're going to run into the washroom. So that could be a reason why you're going into the washroom quite quickly. You're urinating fast, and every 2 minutes you're wanting to go because you're gulping down the water. Now, certain medication as well, and nurse would agree, certain medications, certain supplements you might be taking, certain vitamins, and even herbal things are diuretics. And diuretics simply means that it's an increase in urination. When you take it, when you take certain medications, certain supplements, certain vitamins, what happens is that it increases urination in your body. So it may not necessarily even have anything to do with being diabetic. And the diuretic is simply a substance, a medication or a supplement or something that makes your kidneys produce more urine, helping your body to get rid of excess salt and water that is built up. So if you have water that is built up in your body will get rid of it if it's too much. So you find that sometimes the doctors will give you prescribe certain medication, like high blood pressure medication. I don't know how many of you know that, but high blood pressure medication is a diuretic. So when you start taking high blood pressure medication, you'd find yourself running into the washroom to urinate. And some people don't even realize that. But it's because of the medication that the doctor prescribes. So you have a choice to say, listen, doc, this high blood pressure medication you gave to me, it has me going into the washroom plenty. Could you give me something else? And these are things, as I'm saying, we don't pay attention to. We don't. The doctor give you that. You don't even realize that you're going to the washroom, but I want you to watch your temple now and start paying attention. And people who have heart problems, the medication that the doctors will give you, sometimes it causes you go and there's too much fluid in your lungs and you're having all kind of heart problems. They give you medication and it increases your urination, cause you to urinate a lot, right? Some people, because they have swelling in their knees and their feet because of kidney problems or liver disease, the doctors will give you something for you to pass the extra water out. How many of you know that? So that may be the reason why you're going to the washroom a lot. It may not necessarily mean that you're diabetic or you're pre-diabetic. If you're having herbs, certain herbal things that you're using, like dandelion extract, oh my, wharton, something called horsetail, uh, juniper berry. Do you know even having black tea and green tea, it will increase your urination? Parsley, hibiscus, and that's the hibiscus flower. Watermelon, everybody knows watermelon. If you have too much watermelon, how many of you know that? You're going to be going often to the washroom. It doesn't mean that you're diabetic. It means that you had watermelon, so you feel the need to go. And even grapes, something as grapes as well, it increases your urge to use the washroom. And celery as well do the same thing. Sweet peppers, lettuce. These are things you all may not pay attention to, but you're going to have to start paying attention to it now to see, okay, am I going too often? Wait, you're taking certain vitamins and minerals like B6, vitamin C, magnesium. These things act as diuretic too. So if you're taking it, that may be something that will help you to pass water and you may not realize it. Sometimes people have a urinary tract infection. You know what is a UTI? You've heard about UTI, both male and female, they get that. your bladder becomes overactive when you have a UTI. Women, and you know that when some women are pregnant, when all women are pregnant, and going through pregnancy and hormonal changes, you will find yourself using the washroom often. It doesn't mean that you're diabetic. And men who have prostate issues, um, eh, because if there's a swelling in the prostate, they're gonna go use the washroom plenty. It may not have anything to do with diabetes. What am I trying to say? I'm trying to tell you that you need to pay attention to your body. So, with this information, what you do, because we're talking about diabetes, right? You want to know, is my blood filled with too much sugar? So, the first thing, you start looking at yourself now. What am I consuming? We just spoke about it. Am I taking medication? Am I taking certain vitamins and minerals? Am I having diuretic herbs? Do I have hormonal changes going on? If you're a man, do I have prostate issues? So you can say, okay, oh, so that's why I'm going to the washroom. So, you could kind of like say, all right, well, okay, I understand. But you have to look at what you're consuming and how much, as that may be the reason for the frequent urination, and it may not have anything to do with being diabetic. Are you following me? Now, if you're not drinking a lot of water, if you're not having diuretics, if you're not having any health issues that I just spoke about, and you're going to the bathroom often, and just to let you know, just a little bit, bathroom is what you use when you go into someone's house, you go into somebody's home, sorry, it's called a bathroom. You go there, can I use your bathroom? A private home. But it's called a washroom or a restroom when it's in a public place. So you go to a fast food place, you go to a restaurant, you go to any place that's having some um, convention or a government building, you go, you say to them, where is your washroom? Where is your restroom? You go into someone's home, you say bathroom. That's just a by the way, all right? So if you find that you're going to the bathroom with an urgency, and not just an urgency, but you find yourself going every 15 minutes or every 30 minutes or every 60 minutes, science says that's too much. You're not supposed to be going to the washroom every half an hour to urinate. If that is happening for every hour, your bladder is overactive. Again, you got to look at yourself. It's overactive, and there may be an underlying issue that warrants medical advice. Could be that you're sick, it could be that you're diabetic. What you need to do is to visit your doctor. Are you all following? As a matter of fact, a healthy person goes to urinate 7 to 8 times a day, full stop. So it means that you're able to keep your urine for more than an hour, maybe sometimes 2 hours. Are you listening? If you're going for more than that, they're saying that your bladder is overactive. You're not supposed to be going so often. We have 24 hours in the day. And of the 24 hours in the day, science said you should only go to urinate 7 to 8 times a day. That's healthy. And if you wake up twice in the night, you're sleeping and you get up twice, and they're just saying twice, anything more than 2 times, again, they're saying that's not healthy. Your bladder is overactive. You shouldn't be waking up 2 to 3 times a night. You should be able to sleep right through the night. But if you're waking up, because sometimes you may have something to drink late that night and you realize you need to use the washroom, pay attention to your body. In other words, what I'm saying and what science is saying is, if you having to go to the washroom interrupts your day, meaning you leave home to go to somewhere that takes you half an hour, and the first thing you're looking for is a washroom. Everywhere you go, you want to use the washroom, you want to use the washroom. There's an urgency to use it. Sometimes people would, when you leave home, most women do it. I think you make sure you use the washroom. You make your body use the washroom. Sometimes if you go into someone's home, it depends on where you go. Not that it's an urgency. You're just saying, just in case, I don't want to use the washroom elsewhere. Um, here is okay place. Let me just use it before I leave. And you use it because there's not, you just make your body urinate. It's not like your body making you urinate. You want to, and most women, we tend to do that, not men. I don't think men do that, but women do. That's different. But if you find yourself, your body wants to urinate, you just can't hold up and you look at, I need a toilet, I need a toilet, and you are not consuming so much water, you're not on medication, come on, you're not having herbal drinks, then science says check it out. Because that is too much. As a matter of fact, you should be able to drink water and move about normal without needing to run. You can't see a bathroom, you need to use it. So how do we avoid that? There's a certain way we need to drink water, and it's the healthy way to drink water. I have been drinking it wrong. I can tell you, I've tested what I'm about to tell you here, and it's really true. It works. We would drink a whole glass. How many of you, like me, would drink a whole glass of water? Give me a chance. I might even drink more than a glass of water. I love water. Can I tell you, I love water. And those of you who have been with me, especially Minister Bernadette, I walk around with a 40-ounce cup, 40 ounces of water. And if you give me a chance, I will consume that water within an hour. And I'm kidding. I'm not kidding you. I love water. I really love water. And I was drinking the water wrong. So it's not about people say, well, I drink lots of water and all these things. I don't understand how this happened to me and why this is happening to me. There's a way to drink water, the healthy way that will bring healing to your body. How many of you know that? How many of you know that drinking water can heal your body, but you got to do it the right way? And so I'm just going to give you a little advice, and it's up to you what you take with this information. We don't gulp down water. Water is not, you're not to take a glass of water and drink down all like you see on television and all over the place. That's the incorrect way. You check now, and science is telling you that they have found that, as a matter of fact, when we drink water this way, we can damage our kidneys because it's too much water. A glass of water, an 8-ounce glass of water, drink. Oh, I'm thirsty. We get up and we just drink, and your handy bottle going crack, crack. How many of you know that you take a bottle of water, you just drink that down in a one? Water will heal your body if you drink the water the right way. Sometimes we think, well, we're drinking water, and because we're drinking water, we say, okay, well, good, I'm not drinking juice, I'm drinking water. But here's the thing, as much as you're drinking water, if you don't drink water the right way, your body is not going to be healed. What is going to happen? It's like, how do I do this? It's like you have a 2-ounce or let me put it this way, at 8 ounce, it's like you have an 8 ounce glass and you're trying to fit 40 ounces of water in that 8 ounce glass. What's going to happen? Anybody can tell me? If you have an 8 ounce glass and you're trying to put 40 ounces of water in that 8 ounce glass, who can tell me what will happen? Anybody? And that's a simple math. Correct. Minister Bill and Minister Candice, it will overflow. And what happens to the water that is overflowing? What happens to the water that is overflowing? There's just one word I'm looking for. What happens to that water? You have an 8 ounce glass. That's right. That's the word I'm looking for. Wasted. Saints, that is what happens when you drink 8 ounces of water one time. Your body will dispel it. It will get rid of the water. As a matter of fact, what they're saying, science says the correct way to drink water is by taking sips. I notice my boys, and it's only as the Lord is leading me to teach this. I notice Judah. I said, why Judah just do that? Judah will take a glass and put a little bit of water in the glass and go back and sit down. I'm like, what are you doing? And he will sip that little bit of water. And I'm saying, this child, in my mind, I'm saying this child don't like to drink water at all. And then Joshua has a water, and Joshua will just sip it and put it down. But I noticed that they do it. And I guess because they're in football and they're trying to do things the healthy way. But it's the correct way that they're doing it. And you would find now that they don't rush to the washroom. They will sleep right through the night. Yes, I know they're young, but even when they go out, no. And sometimes I say, you don't want to use the washroom? I'm going to use it. Mom, I don't want to. I don't. I don't know. I don't. And it's like, in my mind. So I am saying that science says if you sip water throughout the day, you will not feel the need to urinate so often. And what happens is that when you sip water, the water now goes into your blood, and that water, one, it will help to build your blood in a positive way. It will help to clean, and you all don't realize that when you're drinking water, there's a lot going on in your body. It will help to clean you properly, clean your help with your kidneys and everything that is positive. And you sip, and here's how you don't just sip the water, but you take about a few sips every 10 to 15 minutes. You don't wait for your body to get thirsty. And when you take sips throughout the day, you wouldn't feel thirsty. When you drink water the right way, you don't get old too quickly. Your wrinkles take longer to come. When you sip water through the day, you're gonna have nice young looking skin like Elder Sherry because her skin is young. She probably sips water. Seriously, when you sip water during the day, your skin get plump and nice. It doesn't look old and hard and beaten because the water now it takes its time and it goes into under your skin. It goes through your cell. It does everything, and have you looking young and feeling young. It's like a plant that you have and you put water. If you put too much water in the plant, that water will just run out. But if you just put a little bit in, and those of you who take care of plant, you realize the plant is healthy, nothing is wasted because you put the right amount of water and the leaves are growing nicely. It's the same thing with your body. Little is much in this case. Too much is gonna damage your body. You gotta understand that. So you take some sips throughout the day. If it means you need to download an app on your phone, download an app that will remind you every 15 minutes to take some sips. Or take a mouthful of water and just drink it down. Just slowly drink it down. If you do it like that, you would not feel the urgency to urinate, and your body will be able to use that water to bring healing. When you gulp down water, saints of God, a lot of the water quickly will go, your body will get rid of it through your urine. It is wasted by your body. And if your body is telling you that you're thirsty, then it means you're not having enough water and you got to listen to your body. Especially as the place is hot, you may have to take a little more. But if you are drinking water the right way and you are not on medication, as I'm saying to you, you're not on diuretics, and you're still visiting the washroom, there's a high possibility, if you don't have a medical condition, that you may be diabetic. And emphasis is on maybe, because I am not a medical expert. Sometimes the place is hot and you're feeling thirsty. I understand that. But take your water by sips or mouthful instead of taking um, some sips of water every 10 to 15 minutes. What you may have to do every 5 minutes, you take a sip of water because the place is hot. Especially if you're doing something like exercising or working in the hot sun. And one of the things you need to start to do now is to look at your urine. How many of you, when you use the bathroom, how many of you look at your urine? You have to. You must. You got to pay attention to your body. Ever so often, you look at it. It's important. So you start looking at your urine. If it's clear, if it's clear like water, it means you're drinking too much water. That's just way too much. Anytime you use you at home, you use your bathroom or even in a public area, and you look at that and you realize what you can't tell what is your urine, you can't tell what is water because it's too clear, then you're in trouble. You're in trouble because it means you're drinking too much water, and think about your kidneys. If you overdo it, you can damage your kidneys. You know what happens when your kidney goes bad? And being a diabetic can also cause your kidney. If your sugar is too high, your kidneys will get damaged. You all ever heard about dialysis? And we spoke about that before. Anybody who's doing dialysis will tell you, I wish that I had known other than what I know now to avoid being on dialysis. People don't like being on dialysis. It's not an easy thing. But you have the opportunity now to stop your body from your temple from going down. So look at your screen. When you look at your screen, and you can pinch it to make it bigger. If your urine is clear like water, and I mean really clear like water, as I said, you're drinking too much. The color of your urine is supposed to be a dull yellow. Dull. I don't even know if this chart is giving, it's supposed to be dull. If you urinate and your urine is like a bright fluorescent yellow, it means that you're on some sort of supplement, some kind of medication. How many of you have taken like vitamin B's, and when you use the washroom, the yellow is bright like real yellow. Don't panic, don't worry about that. That is because of what you're taking. All right, so you know that you're having that. So your urine is supposed to really be pale, a pale yellow, kind of, and once it's pale like that, then you know it's good. But then if it gets like a darker yellow, you can look at it and say, I don't like how this color looking. I think maybe I need to have some more water because it should be pale. And as I said, I'm trying to get a diagram that would kind of really give the color that I'm looking for, but it was a bit difficult to get it in real time. But it's a kind of dark color urine, right? And I'm sure when I say dark, I mean a dull, sorry, a dull, um, a pale yellow. and that is fine. But if this pale yellow looks a little dark, just a little darker than normal, then you have to say to yourself, well, maybe I'm drinking too little bit of water, right? Let's see if you can pull this one up for them. And then if it looks darker than normal, then it means again that mm, you're really not drinking water. You're really not drinking enough water, and that can become a problem. So let's look at this. This one looks a little better. I think it's kind of more closer to let me see if I can, Joshua could just make it a little bigger, please. I want you to keep your eyes on the screen, all right? It's just, again, to help you to look at your temple. So the first one is what you want. This looks very much like close to the color. The first color on top here is what is a normal color urine. You all paying attention? If you find that your urine is now looking yellow, like this really looks yellow, you have to say, all right, I need to drink some water, because you want a pale color like this. If it's too yellow, you need to increase. If it's very, very yellow like this, as I said to you, it could be maybe taking medication and it's causing it to be like that. So if this is happening, it means, all right, you need to, it's medication, and it's because of the medication. If you have this color and you're not on medication, watch that. That's not good. And as it may seem that people have urine this color. Yes, some people, their urine is brown in color, really, really brown. Are you all seeing this? This is not good. This is really not good. And this is even worse, this darker color. And if this is happening to you, saints of God, it's not something that you ought to take lightly. Amen? Are you all following? And when your urine is dark in color, what I want to say to you is this: if your urine is that color, I guarantee you that you are constipated. Because when you're not drinking enough water, how many of you, if you are experiencing constipation and you cannot go off, it simply means that you may not be drinking enough water. Lack of water causes constipation. Are you listening to me? Do you know why? And I'm saying this. Some of you, if you're not drinking enough water, not drinking enough water will cause the constipation. And you know why that happens? It happens because your colon pulls water from waste, and your urine becomes dark yellow or brown in color when you don't have enough water. And then because now your colon starts pulling water from your body, from your waist, it starts pulling water, even with water in your head, all the places that have water, it starts to pull, you start getting headaches. And that's why sometimes you hear people say when you have a headache, what is it to drink some water? How many of you have heard that before? So we need to be very careful, because if you don't, and I will say it again, if you do not drink water the right way, if you overdrink water, you will damage your kidney. If you don't drink enough water, you will damage your kidney. The right way to drink water is every 10 to 15 minutes, you take about 3 sips of water. Don't gulp down a glass of water. And if you start practicing to do that, you would find you don't feel thirsty. You just take it, you take a little mouthful, and that's it. It works. I've tried